Hi.
My name is Dr. Davis. What brings you in today?
I'm feeling hoarse and I have a cough. I'm very tired with a fever. Why aren't they responding?
Sorry to hear that. Have you experienced this before? Any history of asthma? Do you have any long-term respiratory problems?
Nothing like this before. I had surgery for my tonsils a few weeks ago, though. They don't seem like they're paying attention to me.
When did these symptoms start?
I would say about 3 days ago, and it's gotten worse.
Tobacco use, alcohol, any diseases running your family?
My dad died of colon cancer, but other than that, nothing like that. I don't smoke and I drink casually, maybe once a week.
Do you have any medications at home?
No, I don't. I took an Advil for my pain, but other than that, I don't take medication.
Have you been feverish, nauseous? Do you have any chills?
Yes, I've been feverish, but not nauseous and no chills.
Any signs of fever?
Nothing like that. I had a slight one for 101, but
Have you coughed up blood? Any chest pain, trouble breathing, shortness of breath?
no, not any of those.
Shows no signs. Possible myocardial infarction shows no signs of near high cholesterol. Did you say Okay. It looks like you have an upper respiratory tract infection, specifically strep throat. We're going to order you a culture lab test to confirm that it's a viral infection. I would recommend taking ibuprofen as well as Tylenol. This sounds good? Okay. Nice to meet you. I'll put the orders in now.
What are those? Were those fatal? Did you even care about me at all?
I wish I had more time to talk to this patient. This write-up will take me at least an hour to do thoroughly. I wish there was a way to handle the EHR.
What's the EHR? Is there someone that could do it for you?
I can help with that! The implementation of the electronic record system has left both doctors and patients extremely unhappy.
Oh no!
Patient satisfaction rates have decreased as patients feel like doctors spend less time talking to them and more time staring at a computer screen. On the flip side, doctors' hours are spent with tedious paperwork and continuous clicking. The use of medical scribes presents a unique solution to this problem.
Cue the scribe.
What are scribes? Well, we are employees, often in college, but also can hold a bachelor's degree that enters orders received from the attending physician into the physician order entry section of the EMR. We also document the HPI, the review of systems, the procedures, and the doctor reevaluation notes, as well as the X-ray and EKG interpretations, as dictated by the attending physician in the EMR. We enter the patient disposition and discharge instructions into the EMR as dictated by the attending physician. We assist in clinical information management, but we also complete other small tasks like wheeling patients into the radiology and more. The role of the scribe is to be as helpful as possible to the doctor in order to increase the effectiveness and the efficiency of patient care. Scribe training offers both anatomy, medical terminology, abbreviations, and much more in order to enhance patient care through scribe training.
This training allows scribes to write detailed notes with proper terminology, thus decreasing the amount of paperwork that doctors must do. Furthermore, scribe training allows them to be knowledgeable about what information is necessary to be included in the charts, and it allows them to be familiar with the proper questions that doctors must ask and that they must occasionally ask to complete a full review of systems. Adding a scribe into an examination room is a win-win for both doctors and scribes. Medical scribes are able to receive clinical exposure that they are interested in for their future careers, and doctors have increased efficiency in their interactions with patients and less time filling out paperwork. Data tracking the progress of scribe implementation supports the use of scribes as an efficient and effective way to better healthcare. Clinical economics and outcomes research performed a study in 2013 on the impact of scribing in one cardiology clinic. According to the study, the productivity of physicians using scribes increased by 50%, and the doctor-scribe team spent 30% less time in the patient's room while drastically increasing the doctor-patient interaction during that time. The revenue and patient satisfaction rates increased as well. This was published in the Wall Street Journal. A study called The Impact of Scribes on Performance Indicators in the Emergency Department, published by the Society for American Emergency Medicine in 2010, similarly noted an increase in the amount of patients visited, as well as an increase in RVUs per hour as well.
The emergency department is one of the most used departments for scribes. Scribes are used by registered nurse practitioners, physician assistants, and doctors. They can be used both in fast track as well as triage. In triage specifically, they're already standing with computers in order to ensure efficient documentation of patient cases.
Oh no, you don't look so good.
I'm not feeling very well, doctor.
Well, my name is Dr. Davis, and this is my scribe, Andrea.
Hi, it's nice to meet you. I'm a medical scribe working with Dr. Davis. I'll be documenting your patient visit just to ensure that you can focus more time on you.
Okay. So, what brings you in today?
I've had a cough for a few days now, and sore throat,
Okay.
and slight fever.
I'm sorry to hear that. Have you experienced this before? Do you have any history of asthma? Do you have any long-term respiratory problems that you may know of?
Not really before. I've had tonsil surgery a few years ago, but
Okay.
other than that, nothing I can think of.
Okay. When did these symptoms start?
It started about 3 days ago and has gotten worse since.
Okay. Any tobacco use? Alcohol? Do any diseases run in your family? Do you know?
No tobacco use.
Okay.
I drink casually once a week.
Okay.
And my dad had colon cancer, but other than that,
Okay.
I don't think anything else runs in the family.
Okay. Do you also take any medications at home?
No, nothing. I took an Advil for the pain, but other than that, nothing.
Okay. Have you felt feverish, nauseous? Have you had any chills?
No, nothing like that. I had a 101 fever yesterday when I took my
101?
temperature. Yeah.
Okay. Okay. Make sure you document the 101 fever. Okay. Have you coughed up blood? Do you have any trouble breathing, shortness of breath?
No, nothing like that.
Okay.
What a great doctor. She's so attentive.
Okay. So do a medical examination of your throat. Inhale. Exhale. Okay. Say on. Okay. Okay, well, the good news is it looks like you have an upper respiratory tract infection, but it's specifically strep throat, which is actually very common. What we're going to do is order a culture lab test to confirm it's a viral infection. It is not fatal at all. It's very common, and you will be fine. So we recommend taking lots of fluids and getting a lot of rest, and you should be back to normal.
Sounds great, doctor. Thank you.
Yep. Do you have any more questions for this patient?
Did you experience any chest pain or lightheadedness?
None of those.
Okay. And when did you take the Advil and how many times?
I took it once per day for the past 3 days when I started.
No, that's it. Thank you.
Thank you.
Okay.
I'll go get started on that note right away, doctor.
Okay, thank you.
The use of medical scribes is truly the solution to the lag created by the implementation of the electronic record-keeping system. Take a leap with us and use medical scribes as a means for more effective and more efficient patient care.